President Trump says the opioid crisis is a national shame and human tragedy. Today, he took concrete steps to do something about it. Chief White House correspondent John Roberts joins us with details from the North Lawn. Good evening, John.
Brett, good evening to you. According to the Centers for Disease Control, some 300,000 Americans have died as a result of opioid overdoses since the year 2000. In some states like West Virginia, Ohio, and New Hampshire, opioid abuse has simply skyrocketed, which is why we heard so much about it during the 2016 election. After months of promises on the campaign trail and the formation of a presidential commission to look into it, President Trump today declared the opioid crisis in America a national health emergency.
As Americans, we cannot allow this to continue. It is time to liberate our communities from this scourge of drug addiction. Never been this way. We can be the generation that ends the opioid epidemic. We can do it.
The declaration sets in motion an initial 90-day response to the crisis and allows expanded telemedicine to increase access to anti-addiction drugs and mental health treatment, expedited hiring of specialists to respond to the opioid crisis, income support for people in treatment, and an increase in access to substance abuse treatment for people in HIV/AIDS programs. Flanked by people on the front lines of opioid addiction, President Trump got very personal in his appeal to reduce demand, talking about his brother Fred's battle with alcohol.
He would tell me, don't drink, don't drink. And to this day, I've never had a drink. And I have no longing for it. If we can teach young people and people generally not to start, it's really, really easy not to take them.
The president hadn't even finished talking before Democrats slammed his plan as unfunded promises, pointing out his budget cuts Medicaid, a critical element of treating opioid addiction.
But the president's statement are words without the money.
West Virginia Democratic Senator Joe Manchin, who attended today's declaration, says it's up to Congress to provide the money. His concern that states with small populations and big drug problems won't get the proportion of money they need to battle addiction.
If you're fighting a war and you're distributing ammunition to all the fighters, and you have fighters on the front line and fighters not on the front line, but they all get the same amount of ration of bullets. People on the front line are going out of bullets quicker.
In addition to declaring a public health emergency, the president is awaiting the recommendations of his opioid commission, headed up by New Jersey Governor Christie. The president today promised the commission's proposals will be swiftly approved.
I cannot tell you how important this will be to the millions of American families out there who have been affected by this epidemic, who have lost loved ones, who are struggling today to reclaim their loved ones from this addiction, to know that the President of the United States cares about this.
President Trump also urged a national effort to develop non-addictive painkillers. He said he will direct the FDA to remove from the market what he called a, quote, truly evil synthetic opioid, Opana, and when he travels to Asia soon, confront Xi Jinping over the flood of cheap and deadly fentanyl pouring into the U.S. from China.
I'm sure when he goes to China, the president ought to get right in the face of their premier and say, listen, your country has got to fight this on that end. You've got to quit sending this fentanyl, these deadly drugs, and let them come into our market.
Well, it had nothing to do with his national health emergency declaration. President Trump today also put in yet another pitch to build the border wall, insisting that one of the most powerful and deadliest opiates around, heroin, continues to flood in across the border from Mexico. Brett?
John Roberts live on the North Lawn. John, thanks.